Every year, thousands of Liberians living in remote communities suffer from preventable blindness, hearing loss, and untreated ear, nose, and throat (ENT) conditions simply because they have no access to specialized healthcare. To bridge this gap, New Eyesight and Medical Center continues to lead one of Liberia's most impactful rural healthcare initiatives. As part of our routine specialized outreach program, New Eyesight and Medical Center, in collaboration with Liberia's only practicing ENT consultant, Dr. Tabe L. Freeman Jr., and ophthalmologist Dr. Unity Honeydoki-Fan, conducted a joint free eye, ear, nose, and throat screening and cataract surgical outreach in Lofa County from June 25th to 30th, 2026. This outreach brought specialized medical and surgical services directly to underserved communities, providing life-changing care to hundreds of patients who would otherwise have little or no access to these essential services. During the outreach, our team met many patients whose lives have been devastated by treatable conditions. One of them was John Jala, a young man whose story moved the entire medical team. When asked about his condition, John shared these heartbreaking words. This started about 15 years ago. I was not born like this. When I was about 4 months old, a swelling started growing around my neck. Before long, my whole neck became enlarged and very painful. I can hardly speak properly. Eating and even drinking water causes me pain. My family is very poor and cannot afford treatment. I am begging for help. Please help me get out of this condition because I am really suffering. If nothing is done, I fear I may not live much longer. John's uncle described the painful reality the family faces every day.
Can he eat with first?
Children refuse to play with him. Even if he drinks from a cup, no one else wants to use it because they believe they will catch his sickness. People avoid him because they are afraid. It is heartbreaking to watch him suffer this kind of rejection. Sadly, John is not alone. During this outreach, our medical team identified many children, young adults, and elderly patients living with cataracts, hearing impairment, chronic ear infections, neck masses, thyroid disease, and other conditions that are treatable through specialized medical and surgical care. Most of these patients come from families that cannot afford transportation, investigations, surgery, or post-operative care. Our outreach has revealed an urgent and overwhelming need for specialized medical care. During our recent assessments, our medical team identified more than 300 patients requiring sight-restoring cataract surgery, 25 patients in need of life-changing goiter surgery, and 115 patients living with perforated eardrums who require hearing procedures, hearing aids, and specialized ENT treatment. These individuals continue to suffer from preventable disabilities simply because they cannot afford the care they desperately need. Your support can change this reality. By partnering with New Eyesight and Medical Center, NEMC, you will help restore sight, hearing, health, dignity, and hope to some of Liberia's most vulnerable children, women, and men. To provide these life-saving surgeries and treatments, NEMC is raising $30,000 to cover the cost of surgical procedures, medications, hearing interventions, medical supplies, patient transportation, accommodation during treatment, and follow-up care for these patients. No gift is too small. A minimum donation of just $1 can make a meaningful difference. When combined with the generosity of others, your contribution helps provide life-changing surgeries, essential medications, hearing services, medical equipment, and specialized outreach to rural communities where these services are otherwise unavailable. To provide life-changing treatment to patients in need, we are seeking your support. The average cost is $75 for a cataract surgery, $400 for a thyroid goiter operation, $50 for ear perforation procedure, $1,000 for complex surgical cases such as John Jala's. Every $1 donation brings hope and helps restore sight, hearing, health, and dignity to those who cannot afford these essential treatments.